pn9. Q. To maintain Bryant's traction, the nurse must make certain that the child's A. Hips are resting on the bed with the legs suspended at a right angle to the bed. B. Hips are slightly elevated above the bed and the legs suspended at a right angle to the bed. Cyrillic letter S. D. Hips are elevated above the level of the body on a pillow and the legs suspended parallel to the bed. Hips and legs are flat on the bed, with the traction positioned at the foot of the bed. Rationale: Bryant's traction is used for fractured femurs and dislocated hips. The hips should be elevated 15 degrees off the bed. Answer A is incorrect because the hips should not be resting on the bed. Answer C is incorrect because the hips should not be above the level of the body. Answer D is incorrect because the hips should not be flat on the bed. Q. Which nurse should be assigned to care for the postpartum client with preeclampsia? The nurse with 2 weeks of experience in postpartum. A. B. 3 years of experience in labor and delivery. C. 10 years of experience in surgery. D. 1 year of experience in the neonatal intensive care unit. Rationale: the nurse in answer B has the most experience in knowing possible complications involving preeclampsia. The nurse in answer A is a new nurse to the unit and so should not be assigned to this client. The nurses in answers C and D have no experience with the postpartum client, so neither should be assigned to this client. Q. A client with sickle cell disease is admitted with pneumonia. Which nursing intervention would be most helpful to prevent a sickling crisis? Obtaining blood pressures every 2 hours. B. Administering pain medication every 3 to 4 hours as ordered. C. Assessing breath sounds once a shift. D. Monitoring for fluids at ordered rate of 200 megaliters HR. Rationale: hydration is needed to prevent slowing of blood flow and occlusion. It is important to perform assessments in answers A, B, and C, but answer D is the best intervention for preventing the crisis. Q. The physician has ordered a SA and acid phosphatase for a client admitted with complaints of dysuria. The nurse knows that a SA and acid are screening tests for phosphatase: A. Cancer of the bladder. B. Cancer of the prostate. C. Cancer of the vas deferens. D. Cancer of the testes. Rationale: the SA, prostate-specific antigen, and acid phosphatase are valuable screening tests for cancer of the prostate. The SA is not a screening test for cancers of the bladder, vas deferens, or testes, therefore, answers A, C, and D are incorrect.